22 out of every 100 men will be diagnosed with cancer. That's pretty rough to hear. It's a scary statistic, and to honor men's health this month, you may say more of the men in your life growing their beards out. We spoke with Dr. Kohli about men's health during Movember.
All right, well, it's officially No Shave November, Movember for so many people. Dr. Kohli, we want to talk to you about this. Can you talk a little bit about the importance of Movember with respect to cancer in men?
Yeah, Danny, it's so important. We spend a lot of time talking about women's health, but not nearly enough talking about men. So the idea here is the little pun on mustache, Mo, and then November. And here we want to raise awareness of the most common cancers in men, but specifically of prostate cancer, testicular cancer, mental health in men, as well as suicide prevention, because we know cancer cases are going to go up, and we know that more than 50% of men do not get regular preventive screening.
Yeah, and this is huge, and that's something that scares me, especially for, you know, those of us and our loved ones in our lives. So why are men so reluctant to go to the doctor?
You know, it's partly cultural, and it's partly specific to sort of the biology of men, but there's this sort of stigma associated with appearing weak or seeking help that I think a lot of men sort of fall victim to. There's obviously, men deal with emotions differently than women, so there's a lot of minimization of symptoms or sort of wanting to escape the reality. Sometimes that happens, and then some of it is actually society. Just like we spend a lot of time talking about women's health and screening, but we don't talk to our men enough about getting checked and making sure they're getting screened. So I'm hoping that you take this month to talk to every man in your life to get screened and to know his numbers so he knows his risk.
Yes, it's so huge, again, for the ones that are in our lives, which is really big. So part of Movember is, like we said, testicular cancer, something that's important to get screened for. Can you tell us what men should know, and should we be checking ourselves? How should it work when it comes to checking for testicular cancer?
Yeah, so testicular cancer has this what's called bimodal peak, which means you'll see one peak between 15 and 35. Often young men, when we don't think about checking them for cancer, so it's really important to educate the young men in our life to be doing this testicular self-exams once a month. And then a second peak around the age of 60 when you might expect it. And even though testicular cancer is rare, the good thing about it is it's really treatable. So catching it early is really very important. So we should tell our men to check their testicles once a month, usually after a warm shower. Look for any lumps or bumps, any irregularities, any changes in the size, shape, or texture, or any tenderness, because any of those could be potentially a sign of testicular cancer. Now, prostate cancer, much more common in our men. 1 in 8 men will get prostate cancer. That's usually a blood test called a PSA test that we start to check around the age of 45, depending on your risk factors. Could be a little earlier, or could be a little bit later.
And these are the tests that we should ask our doctors about?
Yes, so those 2 tests, but also we want to ask about colonoscopies, right? So every man over the age of 45 and woman should get a colonoscopy, and your doctor will talk to you about that. Heart disease screening, right? The #1 killer of men and women. And the time to start is actually in your 20s and 30s, but if you're in your 40s, you certainly want to ask your doctor about not just the cholesterol, the blood sugar, but also a test called lipoprotein A, which is a new marker of risk that 20% of us have elevated that actually puts a big target sign on you that you're going to go on to have heart disease. There's an X-ray of the heart called a calcium score after the age of 40 that tells you if you already have heart disease. And then let's not forget about our vaccinations. So men often don't get vaccinations as much as women. And one in particular is HPV, which everyone thinks is a female-only vaccination. But we actually want to give it to our men, not just to protect the women, but also to protect them from conditions like penile cancer and such.
All right. All really important things, especially for this month, but for all year round. So Dr. Kohli, thank you so much for helping us make sure that the men in our lives are staying healthy.
Thank you, Danny.
Of course.
And to learn more about men's health and the Movember movement during the month of November, you can visit us.movember.com.